Good morning, everyone, and welcome back. I am Dr. Nicola De Robertis, and today I want to show you another case of guided magnetodynamic surgery, a technique I have been using for 8 years now with great satisfaction, in combination with open tubular guides. Here is the case at baseline. Placement of 2 implants in quadrant 1, one in position 15 and one in position 17, with planning carried out using the SMOP software. In this specific case, the main challenge is stabilizing the implants in D4 bone, which is of poor quality. This is where the magnetic mallet makes a difference, allowing for a cold, non-subtractive preparation. The guide was designed by the company Twingus and was printed in-house with a frozen desktop printer. Here you can see the printed guide in position, with a small flap to visualize the crest. This way, we can be sure that we are approaching it at the exact point we plan to. In this case, I initially performed a ridge regularization using a flat drill on both sides. Here you can see the Osseotouch X kit dedicated to guided surgery. This is the specific dolly adapter for this type of guide. And here you can see how the adapter is mounted directly onto the Osseotouch osteotome. This is the first osteotome, the 100i, used for the approach to the first implant set. And here we see the second one. In this case, for the implant in position 15, the 375 for the 10.5 was planned. The only oscillants used were the 33, so the 100p, the 100, and the 160. Whereas for the implant in position 17, which as we'll see later is a 5x10, I also used osteotomes up to the 330, using the 330 only in the coronal part. Here, a small adjustment was made, mainly with the drill in the first 3 to 4 millimeters of the preparation. The same thing will also be done for the implant in position 17. And here is the placement of the first implant, 3.75 by 11.5. Everything was done very calmly, quickly, and I'd even say cleanly. This is the completed placement of the first implant. This is the adjustment of the coronal part of the preparation with the short drill and the placement of the 5x10 implant. You can see that with this type of guide, it's also possible to work in the posterior areas, thanks to the concept of saving important space, something that would actually be difficult with a traditional guide with sleeves. Here is the second implant placed as well. At the end of the procedure, the final abutments were also placed, and then this superimposition was performed to validate the accuracy of the work done. Anyone interested in learning more about these topics can contact either Osseotouch or me directly at the email address, nicoladerobertis@gmail.com.